Good afternoon. This is a training video about HIV/AIDS. I will try to make it as short as possible. In the first part, we are going to be covering about almost 25 or 30 slides out of 59. The most important aspect of parts of this training material are contained within slide number 4 to number 58. It is my advice that for those therapists who are under my supervision and those who wants to renew their license or certification that will need the hours, credit hours, to contact me for a copy of the PowerPoint presentation and then the quiz. Do the quiz and then get a certificate for the training. Meanwhile, I will go on to start reading from the my copy of the PowerPoint presentation, which is also displayed online. Um, it talks about HIV/AIDS, the history of HIV/AIDS, which started in 1981. The definition of HIV/AIDS is HIV means human immunodeficiency virus. AIDS is acquired immune deficiency syndrome. Um, the disease itself, HIV, weakens the immune system, thereby causing the white blood cells, uh, the CD4, the count to diminish to the point where the immune system become compromised and the subject then becomes vulnerable to or susceptible to all kind of diseases. Um, People with HIV are said to have AIDS when they develop certain infections or cancers because the immune system is compromised. So they are likely to develop all sort of other complications. The statistics with regard to HIV/AIDS are produced by CDC. So in most cases, we have several slides here that deals with the statistics with regard to HIV/AIDS, and you can get all those from the CDC. There is no need to memorize all that, but it's just to have an idea of where we are in terms of number of people infected and the period, and how many people have been treated, and what kind of medication are available for treating the disease. So the early stage of the disease is called the acute retroviral syndrome, which is a primary HIV infection stage. Then the symptoms at that point would be a fever, swollen glands, sore throat, rash, fatigue, muscle, and joint pain. Symptoms can last for days or weeks. You cannot rely on the symptoms to determine whether you have HIV or not. It is better to have a test done so that you can have an idea. At that point of the infection, people will start to really get into having a soaking night sweats, shaking chills, or fever over 100, cough, shortness of breath, and so on. There are also situations where um, there may be what we call refer to, which is the middle stage between HIV and developing AIDS. They call it the clinical latency stage. This is the stage where the virus is living or developing in a person without producing symptoms. At this stage, the HIV virus reproduces at very low levels, though active. Those who take ART, which is the treatment, the drug designed to treat HIV, which helps to prolong the life for people. This drug ART is called antiretroviral therapy. They may live longer with clinical latency status. People may live longer. And that HIV does not always mean you have AIDS. It can take years before it develops into full-blown AIDS. And in this situation, it is only if it is not treated that HIV can progress into AIDS. There are lots of people who have been affected, who still are living. Magic Johnson is one who are still living and not have not developed a full-blown AIDS. Then HIV attacks and destroy a type of white blood cell called the CD4. And this cell's main function is to fight diseases. So which means the immune system is compromised at that point. When the CD4 level gets low, the infected person are more susceptible to illnesses. Now, AIDS, the definition for AIDS is acquired immune deficiency syndrome. It is the final stage of HIV infection. At that point, the HIV has developed into full-blown AIDS. The symptoms when someone has full-blown AIDS are uh, well, the symptoms will be recurring weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpit, the groin or neck, diarrhea for over 1 week, sores of the mouth, anus, and the genitals. There are also pneumonia, red or brown or purplish blotches on or under the skin and inside the mouth, depression, and memory loss. Common ways to infection, these are ways by which people could be infected with uh, the HIV, is anal sex in general. In anal sex, having multiple sex partners, sharing needles for drug addicts. Less common method of infection are birth through an infected mother, being stopped by an infected needle. It doesn't mean you won't be infected, but it's not very common. Being bitten by an infected person, oral sex, broken skin contact, deep open mouth kissing. Common ways to infection: eating food that was pre-chewed by an infected person. I don't know who want to eat food that was already pre-chewed by someone else. Complications. Um, HIV infections weakens the immune system, thereby making the subject susceptible to numerous infections and certain types of diseases and cancers. Infections that are common to HIV/AIDS are most common in poor nations is tuberculosis, salmonellosis, contracted via food. There is also other diseases like candidiasis. Um, they have the cryptococcal meningitis as well as part of the complications. There is a whole long list of complications that can happen or that can follow with the development of full-blown AIDS. Now, it is important to note the following things. HIV cannot be spread by air, water, insects, saliva, tears, sweat, casual contact, sharing bathroom, or swimming in a pool with an infected person, sharing cups. It is also important to note that HIV cannot be spread through the air. It does not live long outside of the human body. Infected person with undetectable low viral load is likely to infect his or her partner, though there is some risk. So as well, HIV may still be found in an infected person's genital fluid because the viral load test measures virus in the person's blood. An infected person viral load may go up between tests. STD is another one. CDC uh, points estimate that 1.1 million people over the age of 13 years of age are living with HIV. About 50,000 people are infected annually. In 2011, an estimated 49,000 273 people were diagnosed with HIV infections in the US. As the last part of the important points to note, heterosexual and HIV drug users continue to be affected by HIV. So this will be the end of the first part of the HIV/AIDS training video. In the second part, we're going to be talking with about the different myths about HIV/AIDS. Thank you.